Salutations, respected viewers. This is George from Ireland. This video is a vindication of the National Health Service. So the NHS is the health service in the United Kingdom, and it's taxpayer funded almost entirely. So it was founded in 1948, and it had been presaged by steps towards it in the previous decades. Around about 1910, the United Kingdom had the beginnings of the welfare state, the idea that the state should provide for those who are not able to adequately provide for themselves. Some people are too old to work, there are children who can't yet earn an income, some people are disabled, some people just suffer very ill health and so on, some people have very low paid jobs. Somebody's got to do the low paid jobs. What are they to do? Just die in agony, avoidably? Now, we'd had charity hospitals for centuries, but they were patchy. Some areas had good provision, some areas had almost no provision. Often there wasn't sufficient capacity to treat the ill and the needy. Some treatments were too expensive, too time consuming, and if you didn't have enough money, you were just going to die. You could have been saved, but you were simply going to die. So I suppose it leads to the philosophical question, should we relieve suffering when we can? I think generally speaking we should. Am I my brother's keeper? Well, I'm not a religious person, but I think it's a question that's worth asking. Don't want to be too self-righteous about it, and I could lead by example. I could give away all my wealth to the needy, but I don't. But anyway, I think it's a laudable thing that as a society we try to help people out, and I know some people have got some responsibility for themselves, so the state shouldn't assume too much responsibility. So about 1910, national insurance had started in the United Kingdom with it was a contributory scheme. The government paying in, employers paying in, and individuals had to pay in out of their wages. It was compulsory, and if they were ill and unable to work, they would be given money to live off until their health recovered. They give you some money towards medicines or some free medical inspections, particularly for school children, things like that. Free milk in school for children, because often children from underprivileged families didn't have sufficient calcium intake, and there was rickets and things like that. So they helped their bones and teeth develop properly. Then fast forward to about 1942, Sir William Beveridge, formerly master of my college, University College, Oxford. He was a Liberal MP, and Sir William Beveridge wrote the Beveridge Report, and he identified the problems of the United Kingdom. Remember, the Second World War was raging, and what was to come out of it, and all these people were not being killed just to restore the status quo, that they had to be building a better society. So many people hoped. Of course, the state assumed control over so many aspects of life in war. Well, why not continue some of this into peacetime to tackle problems? If the state can assume extraordinary powers to kill people, can it not do so to save people? He said that it was about healthcare. We should have a scheme where the individual and the state contributes, and we'll fund healthcare that way. And he assumed that because illnesses will be treated at an earlier stage, it would actually reduce costs in the long run. Unfortunately, he was sorry to mistake on that one. He promptly lost his seat, but was ennobled as Lord Beveridge. Anyhow, so the Labour government came in under Clement Attlee, and the new Secretary of State for Health was Nye Bevan, this renowned Labour MP from Tredegar in Wales, and he'd set up a Tredegar Medical Society, his home constituency, and lots of people contributed, and that cut the cost, it spread the cost between everyone, and I think the local council paid in as well, and that provided medical care to ordinary people, because previously a lot of working class people would find the doctor prohibitively expensive, and not all doctors were willing to do it for free. And those doctors, such as say my grandfather, who were very charitable people, they made big sacrifices, but it's asking too much. Why should they? They should be paid for this work as well. And then we can be sure that everybody, no matter how penniless, will be treated adequately. It shouldn't be based on the ability to pay. So you estimate the cost of healthcare for the whole society, and then you pay for it through taxation. How about that? While still allowing private medical care. If you've got tons of money, if you want private treatment, you can get that. I've got it in the United Kingdom. So in a sense, I suppose it's redistribution of wealth. The millionaires and the billionaires, they could afford to pay a tiny, tiny bit more to save the lives of the poor. Is that wrong? Don't you agree? Because some people say, no, we can't have the super rich paying even a penny more to save the lives of the impecunious. So it's a taxpayer-funded scheme. There are also economies of scale, having so many hospitals, so many doctors, so many nurses. or also medicines, bulk buying, saying to the drug companies, which are still private, that we'll buy your medicine and we'll buy so much of it, but you have to give us a very good price, which is why it's very affordable on medical equipment and things like that. So patients pay for almost nothing. There are NHS dentists, not very many, often have to pay to go private. NHS glasses, I think, are free. I don't need them. Eye tests sometimes are. Stuff for children is always free. For adults, almost everything is free. Seeing a doctor, seeing a nurse, operations, medicines, prostheses, virtually everything is free. There are some postcode lotteries, like if you want in vitro fertilization, depending where you live, your postcode, that zip code in the United States, some places it's free of charge, some health authorities say, you have to pay. In my view, you should always have to pay. I'm afraid it's not a priority. We've got to sort out what is more important. The NHS is not necessarily socialist, but I think it was Nye Bevan said that priorities are the religion of socialism. There are people who've got terminal cancer and they can't be saved, but their lives could be extended by a few years by certain drugs. And in some postcode lotteries, some postcodes, the NHS authority says, well, we won't pay for that because it's not financially worth it. Well, I would say extend their lives. Don't give IVF. If you can't have children, well, that's a plaintive tale for you, but I'm afraid that is not a priority. We've got to save people's lives rather than make people be born who otherwise would never be conceived. You want to IVF, pay for it yourself. It's quite a controversial thing anyway, because a lot of these fertilized embryos are discarded. Well, likewise, sex changes are said to be more cost-effective than therapy. And some places will be paid for, other places won't. So that's that. I mean, I would think over 99% of medical procedures and medicines are funded by the NHS. If you go through the NHS, you could pay to go private instead. So my experience of it overall is superb. That's that. I have a very high opinion of the doctors and nurses in almost all cases. And the doctors are handsomely paid, GPs, general practitioners or family doctors. At the peak of their career, they were earning well over £100,000 a year in most cases. They're some of the best paid in the world. The very best paid, I believe, are in the United States. So they don't need to be so incredibly well paid. Medicine wasn't always astonishingly well paid in the United States. If people are primarily actuated by money, they ought to go into banking or set up a business or do something financial. If you want to be a physician, it's presumably because you want to heal and save lives. If money is the most important thing, surely that's the wrong career for you. In countries such as France, doctors only typically earn about half of what they earn in the United Kingdom. A place like Romania and Russia, it's not well paid at all. When I was in Romania, I saw an advertisement saying doctors can earn 11 times more in Ireland. Doctors in Russia are not well paid at all. They'd be doing well to get $800 a month. It doesn't mean that they're not as good. I mean, some people in the United States say, yeah, but our doctors are way better because they're paid more. Well, it's not always about the profit motive. I mean, they might be better, I don't know. They're not that much better. They're not 10 times better than they are in Eastern Europe, and obviously the cost of living is a factor as well. So the NHS is superb for many reasons, and obviously it cuts costs, as I pointed out. So some people have really got an eye on that. And it saves lives in a huge number of cases. And that's why the United Kingdom's got a very high life expectancy, one of the highest life expectancies in the world, about 78. The very highest in the world is about 82, if I got that right. France, or is it Norway? Depends which study you read, and it fluctuates a little from year to year. Now, I know there are other factors like murder rate brings it down, or suicide rate. Obviously, the NHS deals with psychiatric issues, reduces suicides that way. There's lifestyle, and the NHS encourages people to have a more healthy lifestyle. The UK's record on obesity is not good. On smoking is quite good. On alcohol consumption is not as good. But, in a free society, I accept people have the right to live unhealthy lifestyles. I don't think we should badger them too much. What's so brilliant about it is you don't have to worry about money. It's paid for by the taxpayer. And yes, we all pay tax. So you don't think, can I afford this? You just go. You get the treatment you need. In some cases, in place of private insurance, you wouldn't do that because private insurance companies obviously need to make a profit. What they really care about is making as big a profit as possible, not caring about their patients. It's blindingly obvious. If they got a choice, we could make more money, we could save this person, we'll choose to make more money. I think more or less every single time. That's what keeps them in business. That's what keeps the shareholders happy. That's what gets people bonuses. So we should take the profit motive out of it. And you can have health insurance in the United Kingdom, but what not many people do, they go through the NHS. So it also reduces costs and the severity of illnesses by going to the doctor early. Anybody would say, a stitch in time saves 9. Now, it's not perfect. People say it's coveted by the rest of the world. Not entirely true. Of course, there are malingerers. There are, some hypochondriacs who just drop in to have a chat. Some people say, well, let's have a £10 charge to deter those who are not serious about it. But then some people wouldn't go who should go. Maybe we could exempt those on low incomes. There are inefficiencies in the system, of course. There's a lot of bureaucracy. Speaking of the doctor or the nurse, he or she is filling in forms all the time. So perhaps that should be reformed. I don't think the private system is any better like that. I've been to the doctor in the United States a few times, not for ages though. But there were plenty of forms to sign there. And often it's to see, will insurance cover this or not? And there's a lot of defensive medicine there. Practicing medicine for legalistic reasons, doing this or not doing that and checking everything out. Overkill, just so nobody could possibly say that you didn't do due diligence, you didn't check out everything possible, because if you treat this patient about whatever, 6 months later, she turns out to have cancer, but you were looking at something completely unrelated to cancer, why didn't you spot it? We can sue you and have to pay a massive malpractice premium to the insurance company, so you'll be covered in case that happens. And obviously ambulance chasing, lawyers and things like that. Obviously, if there's malpractice in the United Kingdom, they can be sued as well, but it's not quite as crazy as in the United States. So, the NHS is a system similar to what you find in most highly developed countries. Republic of Ireland, we've got a sort of mixed public-private system, and the poorest third of the population have got medical cards, which is to say that they benefit from free medical care, whereas other people get medical insurance through their jobs, and people don't seem to be there moaning about it being exorbitant. So I don't come from an ideological position where I'm prejudiced towards the NHS and public service generally. I don't pretend it's perfect. If there's a private system which is more affordable, which is more efficient, which is fairer, which would provide me with medical care just as good, where I wouldn't have to worry about the cost of it being ruinous, then I might go for that. And no, it's not the end of the world, and it's not totalitarian, and it's not the government ruining everything, and it's not communist. So all these people try and frighten you out of something very sensible, publicly funded healthcare, which will give people the treatment they need without seeing whether they can afford it. People are not terrified to go to the doctor because it will be prohibitively expensive. So that's the NHS. This is my defence of the NHS, which overall is outstanding, and a very high opinion of its doctors and nurses. And without valorising it too much or pretending it's flawless, there are ways to improve it. But overall, I'm very glad that I can benefit from the marvellous service of the NHS.